evening. Today is Wednesday, May 27th. Welcome to the weekly live Facebook question and answer forum hosted by the Stanislaus County Office of Emergency Services. I'm Linda Muma with Stan OES.
And I'm Amy Vickery, Stanislaus County Public Information Officer. We will both be moderating tonight's live event, which will be recorded and later posted to the Stan Emergency Facebook page and YouTube channel.
You won't see us on camera tonight, but you'll hear our voices as we help direct your questions to our panelists.
Tonight, Stanislaus County Public Health Officer Dr. Wei Shampayan is back. She's joined by County Parks and Recreation Director Jackie Dwyer, as well as our Chair of the Board of Supervisors, Kristen Olson.
Let's begin tonight's panel with Dr. V for an update on the number of cases. An update just came in late this afternoon. Where does Stanislaus County currently stand?
Yeah, so we currently are at 677 cases that we have confirmed and 28 deaths.
Thank you, Dr. V. Are there any specific trends we are noticing or concerned about nationally or locally?
Well, we're continuing to see transmission here in Stanislaus County. I would say we're seeing a pretty steady rate of new infections occurring, and that's not unexpected. Nationally, sadly, I saw that we reached 100,000 deaths today.
I'm going to stick with you for just a moment, Dr. V. We got a Facebook question throughout the week. Now that so much has opened here in the last week or so, do you expect to see a huge increase in the number of illnesses? And if so, are local hospitals currently prepared?
So I'm hoping we don't see a huge increase. We are continuing to increase the mixing in our population, right? People going out more, more businesses open, and more people going to those businesses. So I do expect to see more cases. We are increasing our testing as well. So I would think we would detect more as well. And our hospitals are ready. As you look at our website under our statistics, you can see our hospital beds and availability. So they are ready.
We'll stick with you for one more moment. There was a direct message that came in this week about hospitals specifically, and this question says, did hospitals notice an uptick of unexplained admittance of people with pneumonia or illness in January or February? I think this would be helpful to know, as we believe this has been here way before the panic and stay-at-home order began. Can you address that?
Yeah, so January and February were pretty much the height of flu season, and I have to say that it was kind of a moderate flu season. We did not see any increase over what was expected from the flu season. So I would say that answer would be no. We didn't really see anything above what was expected during January and February.
Thank you, Dr. V. I'm going to move on over to Supervisor Kristen Olson. Kristen, new church guidelines were released this week. Is our worship guidance still in alignment?
It is in alignment. Our local safe worship guidance, which was put together by a number of different faith leaders throughout Stanislaus County, I would say is complementary to the state guidelines that were put out on Monday. They're not exactly the same. They're different. Our local guidelines, for example, didn't speak to capacity of either 25% or a maximum of 100 people in the building, but they do complement one another. But the state order does take precedence, the state guideline, which allows churches to reopen, which is exciting. Places of worship across the county can open now, up to a maximum capacity of 100 people or 25% of building capacity, whichever is less.
Thank you, Kristen. I have another question for you. We know that just this week, the governor announced that hair salons and barbershops can open. But we also know that the state originally had hair salons in stage 3. So does the decision to open salons now mean that we are in stage 3?
We're as confused about this, actually, as the public. I know Dr. V was on a call with the State Department of Public Health, and they had suggested that hair salons were going to be moved into stage 2, and that counties who had been granted a variance, as Stanislaus County has, would be allowed to open hair salons and barbershops, which is what the state did. But they didn't officially move them into stage 2. So I suppose one could suggest we have begun the initial aspects of stage 3. That doesn't mean we can begin to open other aspects and businesses of stage 3. That is still under the state order. But those counties across the state, and I think there's about 47 of us at this point who have received approval for a variance, can open both hair salons and barbershops, which are part of stage 3, but nothing else in stage 3 have we been given the authority to open at this time.
I'm going to switch gears and head over to Jackie Dwyer with the Parks and Recreation Department. A lot of residents are looking forward to summers spent at the reservoirs. Unfortunately, operations look a little bit different this year. What is open and who is allowed to visit the facilities?
Sure. Well, as of right now, Modesto Reservoir is open for restricted day use, which means you can bring motorized water vessels into the park, and you can use them for recreational boating purposes. The one thing we're not allowing is shoreline activity at this point, which means you can't pull in and have a picnic with your family that's on the boat. You can't swap out jet ski riders. You can't do fishing on the shoreline, no equestrian use. You can use the shoreline to use the restroom, but we're not allowing congregating. That is about to change. On June 6th, we will be opening up both Modesto and Woodward Reservoir to shoreline use as well as camping. Again, that is just for Stanislaus County residents only, though. At that point, Stanislaus residents will be able to use the shoreline for picnic activities, not group picnics, but you can go there for the day and spend time with your family, swim, camp. You'll be able to use your horses, hike, use your water vehicles. All of those aspects will be open. Additionally, LaGrange OHV Park will be open on the 6th. That isn't being restricted to Stanislaus County residents, and that'll be open for day use and camping as well. So all of that begins on June 6th.
I'll stick with you for just a moment because I had a follow-up question. And this has to do with parks and that residents-only restriction. Why is that in place?
So one of the things that we were trying to accomplish is following the state guidelines, the state health order guidelines, and one of the restrictions is that people should not be venturing far from home to recreate. We took that to mean that they should be staying within their county restraints. So that's the tool that we've used to implement the county restrictions as of right now. This is a temporary order. We don't expect for it to last. It is constantly being reviewed, and we hope that in the coming months before summer's over that we'll be able to lift those restrictions. But it's really to make sure that people are staying close to home to participate in the recreation activities. I did want to add one change this year to our reservoirs that it's not really a change. Back in 2018, California boaters were required to get their boater safety card. This is the first year that Stanislaus County Sheriff's Department will actually be enforcing that regulation. And if you need more information on how to get your boater safety card, you can go to californiaboatercard.com, and the information is there. As of 2020, it's needed for people between the ages of 16 and 35. That restriction will go up 5 years in 2021, so it'll be 16 to 40, and then subsequently 5 years of age every year after until it maxes out at 65. The card that you receive is good for the entirety of your life, so it's not like it's something that you have to renew consistently, but it is something that the Sheriff's Department is going to be making sure that people have this year. One of the questions we do get about it is, does everyone on the boat have to have one? No, only the people who are actually operating the boat need to have the boater safety card on them.
That's a lot of great information, Jackie. Thank you. I want to stick with you for a second because you mentioned camping at the reservoirs and that we were going to open up our campsites soon. What is the protocol this year for camping?
Oh, sure. So in order to make a reservation at our campgrounds, people are going to need to go to Reserve America. So that's www.reserveamerica.com, and they'll need to reserve a space. And what we're doing to meter numbers and to make sure that we are able to achieve social distancing based on state guidelines is we're only allowing people to camp in our pre-designated camping areas or our developed camping areas. We haven't opened up the undeveloped areas yet because there's no way for us to kind of isolate the areas and make sure that people are separated, and it forces us to open more public restrooms, which also increases some issues with safety for people who are utilizing the park and our staff. So as of right now, people are going to have to make reservations via the website. That may change later on in the summer. Woodward Reservoir has about 79 reservations, 79 spots that can be used, plus 20 walk-in spots. Those are going to be done on a first-come, first-served basis. And then Modesto Reservoir has about 170 spots that can be reserved.
Fantastic, thank you. And since we're on the topic of outdoor activities, I'm going to go to Dr. V, and this is a Facebook question from Jane. Jane says that she misses water aerobics classes. We stay 6 feet apart. Will the public pools reopen for this summer, and do you think that will be safe?
So that sounds like great exercise. Staying 6 feet apart is obviously our good social distancing. Under the state order currently, public pools are closed, and so hopefully they will reopen soon, but as of now they are not. I do believe they will open sometime this summer, especially for activities where social distancing is maintained, such as classes.
Thank you, Dr. V. A question came in this week from Luann, and actually it's kind of a 2 or 3 part question. So let me know if you want me to repeat any of this. But she says that Dr. V mentioned recently that 40% of our cases were from mass gatherings, nursing homes, and warehouses or workplaces. But she wants to know, where are the other 60% from? And then she also said, of the 600 plus total positive COVID-19 cases, how many have been hospitalized? Finally, she would like for us to address the rumors on social media that CPS can take your children if you test positive for the virus.
Okay. So I think when I talked about, and I think that was 2 weeks ago when I presented the slides, and those were just 3 individual events where they had quite a bit of transmission. So that was the 40%. There are many other smaller activities. So we have a couple Mother's Day gatherings that I think have totaled about 15 cases, smaller outbreaks, I guess you'd call them. There are some with 4 and some with 6. So I just had pulled out 3 of the large ones when I talked about that. So many of them are from these gathering events. Many are from workplaces and employees. I think people worry about interaction with the public, but they forget about interaction with each other. And that's one of the things that I keep trying to stress, is that, anyone outside your household increases the risk of infection, and you need to continue to take precautions in the break rooms and other places. Let's see. I know the last one was about CPS, and so that is not, as far as I have ever heard, true. That would not be a reason for CPS to get involved if you develop an infection, not by any means. What was the second question?
The second part was, of the 600 plus cases of COVID-19, how many have been hospitalized?
So if you go to our website again, schsa.org or standemergency.com, either one, you can get to the COVID page. And if you go into the statistics, there's many different statistics. There's about 5 different tabs, and you can look at the clusters. And so I talked a little bit about those right before. And then there's a hospital tab as well, and then it can tell you exactly how many people have been hospitalized as of today. It's a little over 100. I don't remember the exact number, somewhere I think around 109, but I encourage you all to go look and explore, because there's a lot of information on those pages.
Thank you, Dr. V. Those dashboards are very useful. So in follow-up to the CPS question, I think a lot of people are concerned about spreading the virus to their children or immediate family members if they get sick. So how would you recommend people protect their family members if they do contract the virus?
Yeah, so if you are sick, people at home, I didn't talk about that in the previous question, but that's another place where we see a lot of transmission. And that makes sense, because the longer you're with people, the more likely that you will spread if you are infected. So home makes a lot of sense that you would see more spread there than just say out and about. So how to protect people is, you need to stay at least 6 feet away. If you are sick, you need to wear a mask in the home. You need to not touch common surfaces. I mean, you really need to stay away and in a different room. Best case is that you use a private bathroom. If you can't, then you use a shared bathroom, and then be sure and clean it each time after use. And, it's just the surfaces. Don't share air with the people, and do a lot of hand washing of you and your family.
Thank you, Dr. V. I'm going to head over to Kristen. We're getting a lot of questions right now just about salon services. Jamie is asking about tanning salons, for example. Debbie's asking about nail salons and when they can open. Can you kind of clarify that for us?
Yes, sure. So yesterday, Governor Newsom announced that hair salons and barber shops only are allowed to reopen in the counties that have been given a variance, which includes Stanislaus County. So across Stanislaus County, in all 9 cities and in the unincorporated area, if you are a stylist who cuts hair, or a barber who cuts hair, you are allowed to reopen your shop and provide services. No other services are being allowed by the state at this time. So no waxing, no facials, no tanning, no tattoos. None of the other services that salons traditionally offer are being allowed to open at this time. They may be opening soon. We're subject to the state order on those activities and haven't received any information on that yet. So at this point, it's important for people to understand it is only for those who are cutting hair and following the state guidelines that were put out.
Thank you, Kristen. We're also getting questions about massage. So I wanted to go to Dr. V for that. Can you clarify massage?
Yeah, so massage with the hair. I wanted to start a little bit with the hair and follow up on Chairman Olson's statements. So it's hair on your head, right? So there are restrictions against touching the face, and this goes into the massage as well. So not eyebrow or any sort of waxing on the face. For this initial opening, avoiding anyone other than yourself or even yourself touching your face. We all know we're not supposed to do that. So currently, it's just on your just haircuts, anything to do with the hair on your head. So it can be the coloring and straightening and all the services that go along with your hair. So it's the same thing with massage. And as you look at risk for transmission, there is no way to do massages with keeping any sort of distance at all, right? I mean, there's a constant touching that's involved with the massage activity. So it's clearly a higher risk than someone doing your hair standing behind you. So there are reasons, as we look at risk, that those have been put in a little bit of a higher risk category than hair. So massage will come, and we all miss them, but we're waiting for the governor's order on that, but understand that the risk does increase with massage services.
Supervisor Olson, did you want to address that question as well?
Yeah, I just wanted to add a little bit more to that question and the others who were asking, well, why not nail salons? Why not tattoo parlors, et cetera? Because I understand a lot of people do think the decisions being made right now at the state level are very arbitrary, and I do understand that. Dr. V explained what some of the differences are, but we're also understanding and wanting to explain to people it's also an effort to not open everything at once, so that while we're doing a slow reopening, we can monitor what the results of that are in terms of community spread, in terms of the increase in infection rates, hospitalization rates, et cetera. So if we were to open all salon activities or similar activities at once, it would become more difficult to then slow the spread if we're seeing a major uptick in cases. So we don't expect others to be too far behind, but by slowly allowing individual businesses or types of businesses to open, we can better monitor and stay on top of the rate of infection in our community.
Thank you, Kristen. I think that kind of bears the question for Dr. V on when we could expect to see some of the results from some of these things opening.
So what we usually see, as you know, if you're going to see an increase from, say, an event, if there's spread in an event, in general, our average incubation period is about between 5 and 6 days. So that means, you'll usually see people become sick within the first 14 days, right? So we're really looking a couple weeks down the road and what we see then. And of course, it's not going to start instantaneously on day one. So are we seeing a slow increase? Are we just holding steady? That will help. As we look at hospitalizations, we know that people in general go into the hospital in their second week of illness. So that might be a little bit longer than that, getting from that 2 to 3 week phase. So it's the next few weeks we want to watch how we do and see if we can stay steady with our case numbers, and we'll just go from there.
So here's a question for you, Dr. V, from a viewer named Matt. He asks, if I have no symptoms, but what do I do if I have no symptoms, but I want to make sure I'm not an asymptomatic carrier?
So testing asymptomatic people gets a little tricky. I think I've said that before, because it's really only like a point in time snapshot. So it tells you with relative certainty that you you're not infected at this time, but it says nothing about tomorrow. So by the time you get the test result back, since it takes more than a day, it really doesn't help you know what's going on. If you feel like you've been exposed and you're not feeling so well, then you have symptoms, and so it's quite a bit more helpful to get the test then. So that's really hard. I mean, you can go get tested, but it's not really helpful for telling you anything by the time you get the results. It's really just a point in time test.
Dr. V, we'll stick with you for just one more question. The question came in from Facebook. Do we have fewer cases in Stanislaus County because of the stay-at-home order?
Oh, I would say absolutely we do. There have been some data coming out looking at what would have happened if you hadn't closed, looking at what would have happened if you closed a week earlier. Looking back, it's always easy to see what you should have done in retrospect. But I absolutely think so. I mean, when we closed down, we had 5 cases, and honestly, at that time, we about a week later started really seeing an increase in cases. So I actually think that the stay-at-home order came at the perfect time for us, because we really didn't see a huge increase, but we did see, a pretty good increase, I have to say. When you look at our data, end of March, beginning of April, we saw quite a few cases each day. So it's nice to see that we came right back down, and hopefully we can stay down low as we increase our going out and going on with our lives.
Thank you, Dr. V. Next question will be for Jackie. Speaking of the stay-at-home order, our kids have been home since mid-March, and many of them are experiencing some serious cabin fever. But we know that the county parks and playgrounds opened last month. Are there any modifications we should be aware of regarding how the parks and playgrounds are operating now?
Sure. Well, we should still be only recreating with members of our immediate family. Parks and playgrounds are open. We actually get this question quite a bit called into the Parks and Recreation office. And I think you have to decide what's best for your family. I have a 2-year-old. I wouldn't necessarily be taking my 2-year-old to the park because I can't explain to him not to lick the slide. But if you have kids that are older and you can have conversations with them about what it means to keep proper social distancing and how to wash their hands appropriately and not lick slides, I think you're in a very different situation. So I think some of it just has to be based on personal responsibility and your comfort level. I tell the people that call in, I don't know what their home situation is. I don't know if they have at-risk parents that live with them. I don't know if they have at-risk cousins that they see frequently. I don't know what it is. So people have to kind of decide what works best for their family. We do continue to encourage them, though, to please only recreate with members of your own house. Don't use shared sports equipment. Make sure to sanitize and wash your hands as frequently as possible, and to just use really good judgment when you're participating in those activities. But it is good to go out and recreate. It is good for kids, and they need to. In addition to that, we do have plenty of activities for kids to do on our Stanislaus County Parks and Recreation page. Not all kids like to go out and run around at playgrounds, so we have some options for kids who have kind of a different aspect on recreation. We have some materials that they can write plays at home. We have home bird watching activities for birds that are native to Stanislaus County. We also have some stargazing activities. We've also put up quite a few tours of places. You can tour different museums all over the world right now, and aquariums are actually doing some really neat activities. They're letting puppies loose in aquariums at night, which I could watch that for hours personally, just watching them walk around and look at different fish swimming by. And then even check the National Park Service, because Yosemite National Park is actually doing this really cool youth question answer section where they're answering questions from kids 10 and under rangers. So they ask things like, what do coyotes look like when they see at night, and how many bears live there? And it's a lot of fun, and it's a way for kids to continue to get to interact with some of their favorite Parks and Rec activities even during this time.
Can you mention that page again?
Stanislaus County Parks and Recreation page on Facebook. Yes.
Fantastic. Thank you so much. I'm going to go to Kristen. We're going to stick with the outdoor activity theme. Jimmy is asking, he says that he sees that outdoor swap meets are approved with social distancing restrictions. How about outdoor car show swap meets?
Yes, both should be fine. I'll tell you, my dad was very excited to hear that swap meets are allowed to reopen. I know we have a lot of swap meet enthusiasts in Stanislaus County. But yes, outdoor car shows should be fine as well. The key is being able to practice social distancing. So if it involves crowding, mass gatherings of people surrounding the cars, then that would not be appropriate. But if there's adequate social distancing and not large gatherings associated with those, and they're being handled similar to a swap meet, then that would be appropriate.
Kristen, one of our viewers asked if there was guidance for youth sports like football and cheer for the fall season. Do you know if that exists and where people can find that information?
There has been a lot developing on this subject matter this week, which we're really pleased and relieved actually to see, because we've been asking for guidance on youth sports for quite some time now as the questions and concerns have become more frequent with summer approaching. And so we did hear Dr. V heard on a call last night with the California Department of Public Health that the state is looking at developing guidelines for youth sports. We are hopeful they may provide something as early as next week. In the meantime, we have a team of local experts in the youth sports field, whether it's in the high school youth sports arena or in recreation leagues, be it soccer or baseball, what have you, Little League, who have gotten together and are bringing their expertise to the table along with CDC guidelines so that we can craft our local guidelines to go into our Good to Go documents, similar to what we've done for the restaurant industry and many other sectors across the economy. So we should be flowing that into our Good to Go document, hopefully within the next few days, certainly by next week. And then once the state provides its guidance, then we'll replace our local guidance with the state guidance as we've done for the different sectors. Now keep in mind, just because we're providing guidance doesn't mean we're allowed to give them the authority to reopen. That decision is up to the state, but we are on a regular basis now, we at the county level, at the public health department level, as well as our state elected official partners, are constantly communicating with the governor's office on a daily basis right now about the need to provide counties with guidance on when these youth sports and recreational activities can open. I think it really opened Pandora's box when the governor announced that professional sports can begin again June 1st without spectators. That has really increased the interest among parents and students and coaches to be able to provide a way for them to recreate in safe, organized ways as well. So a long-winded way of being able to say we will have guidance soon, and we are hopeful that these activities can begin again, under new protocols, social distancing and safety protocols, but that they will be able to begin again soon this summer in Stanislaus County.
Thank you, Kristen. I'm going to go back to Jackie because we're getting a couple of questions about other outdoor activities. For example, Cheryl's asking, what about river rafting on the Stanislaus River? Is that okay to do?
Yes, there's no restrictions on putting rafts in the Stanislaus River. It really depends on if the access points are open or not. So one of the issues that we faced is we don't control all of the access points on the Stanislaus River. So the Army Corps of Engineer actually oversees things like Knights Ferry, and we do get a lot of phone calls about that. I have spoken with the Army Corps of Engineers, and they just haven't made a decision yet as to the date they are going to open. They have a pretty large chain of command. I'm sure you can imagine being part of the Army Corps of Engineers. So they're kind of waiting on direction from the top as to when a appropriate and safe time is to open. But if you can access the river from any of our fishing locations, please feel free to do so. Rafting's a great recreational activity, and you're welcome to enjoy it.
Thank you, Jackie. Diane is also asking about day programs for adults with developmental disabilities.
As far as should they?
I think what she's hinting at is what is available right now in terms of activities for developmental disabilities.
Sure. So I would actually suggest that they reach out to their more local Parks and Recreation department and see what kind of services are offered through them. Stanislaus itself doesn't offer program-specific courses of that nature, but if you live in Turlock or Modesto or Patterson, I would definitely talk to your Parks and Recreation department about that, or possibly even your adult education department and see what they're offering. I know senior citizen programs are starting to get back up and running in certain areas, so they may also have an idea there as well as far as other adult education or adult day programs go.
So another question for you, Jackie, from one of our Facebook viewers, Skip, wants to know about the reservoirs and the people who don't live in our county but have bought an annual pass to the reservoirs and are not now allowed to use them. What would you say to Skip?
I would say to please contact our office, and we definitely have some options available. We know this is terribly frustrating for people, especially people who don't live in Stanislaus and like to use our reservoirs for activities and fishing, and we do have a few options available to help get you some money back.
Thank you. I'm going to head over to Dr. V, and Skip is very active on our Facebook page tonight. He's got another question. Skip wants to know the deaths that are contributing to our numbers here in Stanislaus County. Are they from COVID-19 only? He said that he's noticed more public statements that the government is possibly over-reporting deaths. Can you address that for Skip?
Sure. So most of the reports I hear are people thinking they're being underreported. So where the way we count deaths here is you have to have a positive test, or at least be in the same household as someone who has a positive test, or someone who's exposed to a symptomatic person and then becomes ill. If the test doesn't get done, that's a different story. But in general, most people have a positive test, and then they will die during their time that they are ill, or so it's hard to explain. But if they completely recover and like go home and then die a week later of something else, that is not counted as a COVID death. So it's really, you have to be ill, and if it's one continual hospitalization and then you get another infection, that will still count because it's the reason that you got hospitalized or in the first place. And so it's a little bit more complicated, but we very carefully review everything before we report the death. So it has to be in some way related with, and pretty much all of ours so far have had a positive test.
Dr. V, can you answer this direct message? What happened to herd immunity? Someone would like to know, if we all go out and get sick, will we build immunity that way?
Okay, so herd immunity is, comes from the veterinary world, right? Animals in a herd. So it's when a population has built up enough immunity that spread really slows down, so that diseases don't spread as quickly. And there's different levels of population immunity that are needed to stop disease. So like measles is so infectious that you need a very high level of immunity to be able to stop spread. This is not measles, thank goodness. And so we would need some immunity. I don't know the exact number. So your question is, do we go out and all get infected? So the problem with that is it will basically eventually lead to immunity. But what we're trying to do is get our immunity in a more measured process, because when everybody goes out and gets sick at once, a certain proportion of people will be hospitalized. And that's what you saw in New York, in Italy, in China, in many, many countries, the United Kingdom, France, Spain. The hospitals get full, and then people die when they wouldn't ordinarily die. So it's all about saving lives, to try to take this measured approach and keep the infections at a rate at which we can be able to respond to them. So I hope that answers. It's a difficult concept, I think, and herd immunity is important. Hopefully, at some time we'll have a vaccine that will build immunity without people getting ill. And so that also works and is one of the reasons we promote vaccines.
Thank you, Dr. V. This next question, or a couple of questions actually, will be for Supervisor Olson. Tammy would like to know if the rent moratorium is still in effect. And a similar question about utilities came in from Anita, asking if we have any idea when utility companies can begin shutting people off for overdue payments due.
Sure. So, yes, rental payments, mortgage payments, utility payments. The suspension on evictions for not paying your rent goes away on May 31st. The governor has that suspension in place statewide. We also have one locally. Unless those are extended, those expire on May 31st. And it's important for people to keep in mind, both renters and also homeowners, because there's been a lot of mortgage relief at this time too. But none of those were payment holidays. So everyone is expected to make up any rent payments or mortgage payments that they may have missed. If they contact their landlords, if they contact their lenders, most people usually work pretty well with their tenants and homeowners. So we encourage people to do that, to try to develop some kind of payment plan that is workable for them. But the eviction order or the suspension of the evictions does get lifted May 31st. As it relates to utilities, it really depends on the type of utility service and the provider. So we encourage people to call that utility provider, whether it's PG&E, MID, TID, OID, the city, and ask whether, one, they can have payment plans arranged, two, when they might be at risk of having services shut off. At this point, and it sounds like the person asking the question knew this, but at this point, utilities for the most part have been directed to not shut off service. It has not been clear when that might be lifted. So again, we encourage people to contact your utility providers, pay if you can, but be in touch with your provider and work out a payment plan that will work for both the utility as well as your financial situation.
Thank you, Kristen. Let's head over to Jackie. We've received a question about off-highway vehicle parks and what is open and what is closed. Can you expand on that?
Sure. LaGrange will be opening June 6th along with the reservoirs, and it will be open for camping and day use. LaGrange will not be restricted based on residency. So anyone who has an off-highway vehicle that they want to use at LaGrange, they are welcome to do so. We are keeping Frank Raines closed, and the reason for that is because if it had opened on June 6th, that's about the week CAL FIRE asks us to close down for the fire season anyway. So it was just easier to keep it closed and save CAL FIRE the trouble of actually having to come out there and issue the notice. We're also doing a major electrical upgrade at the camping sites at Frank Raines. So this kind of timed out at a decent time for us to be able to get started on those a little bit earlier. So June 6th, OHV Park at LaGrange will be open again.
Thank you, Jackie. Just a general update for those of you who may have tuned in late to the feed. Once this posts, we encourage you to go back and watch the video from the beginning, as your question may have already been answered. So our next question tonight is for Supervisor Olson. We had our superintendent of schools, Scott Kuykendall, on last week, and a lot of parents are wondering about what's happening with the upcoming school year. We know local schools are still planning at this point to open in August, but we've talked about how our kids have such a hard time keeping their germs to themselves. Do you think that decision will stick even if our case numbers go through the roof this summer?
I have been one of those parents who thinks daily, sometimes hourly, about the school situation and are they really going to open? What if they don't open? Do I need to hire a teacher? Right? There's just so many questions, I think, swirling around our minds as parents and also as students, right? For the first time, maybe ever, students are excited to go back to school. And so, yes, we have heard from our school superintendents that schools will reopen here in August as scheduled, as planned. But schools might look a little different than they have in the past. And both the state and our local school districts are working feverishly to put guidance into place so that schools have time to prepare for those safe openings. So we heard that the state should be putting guidance out perhaps as early as late this week for school reopenings, could be early next week. And then Dr. V is meeting, she meets with our school superintendents on a regular basis, but she has a specific meeting with all the school superintendents in Stanislaus County next week to work with them on safe reopening plans. Again, they will look a little different, but we do expect schools to reopen as planned. I know Modesto City Schools opens August 10th, I believe. So early in August, we expect schools across the county to open, and we will keep people informed, and their schools will keep people informed just as soon as more information is known about how those classes classes and other activities associated with the schools will take place. I know there is a lot of anxiety on these issues right now. And so we just really want people to know we will get information to them just as soon as it is available, but they can rely on schools reopening as scheduled in August.
Thank you, Kristen. We'll head over to Dr. V. With temperatures rising, this is a timely question. Several studies have recently come out about whether heat and humidity can impact the spread of the virus. What are your thoughts on that?
So heat and humidity absolutely can impact the spread of the virus. The higher the heat and the higher the humidity, the less spread in general there is. The virus doesn't like heat. You can store it in a freezer, but it does not like heat at all. So how much will it decrease spread, though, I think is really the question. And most people think it will decrease it some, but not enough that we can ignore our social distancing and ignore our new way of life for the next while. It will probably decrease the spread, but not enough to stop spread. So, flu, modeling after flu doesn't go away in the summer either. It goes down to a very low level, but we will still see flu over the summer, but it's just such a low level. And I expect this would be like it spreads a little bit more easily, and we have a more susceptible people because really no one's immune. Very few people will be immune at this point. And so it will continue to spread, I believe.
Thank you for that, Dr. V. We're going to head back over to Kristen. I'm just going through the Facebook feed here. Terry asked a question. She said that in Newman there are some nail salons and some gyms that are open. Wondering why?
Is that the whole question?
I think
Why?
so. I think that's
Okay, so yes, we have heard that there are businesses here and there across the county who have reopened, even though they're technically not allowed to under the state order. So we are reminding businesses and us as consumers that we do fall under the state order and need to follow the state guidelines. Having said that, enforcement really is taking place from a complaint-driven perspective as well as from state licensing boards. So state licensing boards, whether it's the cosmetology board, whether it's alcoholic beverage control, have been pretty strict about following up with businesses who are not supposed to be open at this time, and we want people to be aware of that. As it relates to, I don't know if it was part of this question or something we were chatting about earlier, but it sounded like a lot of people were also asking questions about businesses who have been allowed to reopen under specified state guidelines. What if they're not following those guidelines? And in those instances, that really is complaint driven as well. And we believe it's an education process. So there's a lot of guidelines to follow. There's a lot of information out there. And so our first response, if we hear, for example, about a hair salon where the customers and the employees aren't wearing face coverings, because that is required in the state guidelines. So if we were to hear about that, our effort would be to educate that business on what is required under the state guidelines, because there could be a lot of instances where people just don't know, and they'll be happy to comply if they know. So we're trying to do the best we can to get the information out there about what the guidelines require, how they need to be followed. But if we see that they're not being followed, first we encourage people to talk to that business owner, talk to the people in that business, try to handle it, through relationships one-on-one. But otherwise, it really depends on the jurisdiction of the city, how they're going to handle it. But from the cities I've spoken to, and certainly from the county's perspective, it would be an education process.
Thank you, Kristen. Here's another question for you on best practices in businesses. In business operations from Miguel. Hi, Miguel. Is there a limit to the amount of people that can enter a retail store, or do the stores follow max capacity regulations for their building?
So there hasn't been a limit. From what I've seen, from what we've seen, it really is up to the individual business and corporation. I know Walmart, for example, follows a specific square footage guideline, and they'll allow a certain number of people in their store per square footage. I think other offices, or excuse me, businesses are doing the same, which is why oftentimes we'll see lines outside of a door with X's on the sidewalk on where you're supposed to stand. So there haven't been any guidelines issued that I've seen by the state that specify a certain capacity percentage or a certain number of people in the store per square footage, but there are a lot of companies themselves that are limiting attendance inside the store based on their own square footage, which again is why we see oftentimes there are lines outside the door, because they want to make sure they're not exceeding the capacity that allows them to practice social distancing of at least 6 feet or more within that store.
Thank you, Kristen. I'm going to head over to Jackie. I think you may have addressed this a little bit earlier, but Michelle was wondering, can we fish at Modesto Reservoir if you reserve a campsite?
You can fish at Modesto Reservoir if you just want to fish at Modesto Reservoir starting June 6th. We'd love it if you'd also camp, but if you just want to come and fish for the day, beginning June 6th, you can come fish at either Modesto or Woodward.
Thank you, Jackie. We'll stick with you. We had some Facebook questions about state and federal parks opening for camping. And you may have touched on this a few moments ago, but do you know if state and federal parks will open to camping, and will there be a limited number of people allowed or modifications that you're aware of?
So state parks, there's 260 of them in California, so they're having a little bit difficulty kind of opening up in sweeping ways. So they have decided to take the approach that they will be opening up based on variance in that specific county or area and the needs of that community and kind of how the virus is impacting that community. So I do suggest that people go. You can go to www.parks.ca.gov, and you can find a list of all the California parks, and you can look up your local parks and see what's allowed there, see if they're allowing biking or hiking or camping, or if even their restrooms and parking lots are closed. So you do want to go to those websites before you drive all the way down there. Some are even requiring or asking that their visitors do not come unless they can walk or bike there, because they are trying to mitigate the spread and really keep it isolated to locals, depending on their numbers in that area. As far as National Park Service goes, I think they're also following kind of the same guidance of it really depends on the area that it's in. I have heard Yosemite will be opening sometime this summer with 50% capacity numbers. I don't know if that's true or not. As we all know, watching this, things change pretty rapidly. I think that might be their goal, but you will want to check out the National Park Service website, and they do pretty frequently update their items, which is the nps.gov. They also have some information there about their refunding of annual passes and what they're going to do with it. So definitely check those places out before you load up the family and make that drive.
We'll stick with you for just a moment because
Okay.
a question just came in from Amanda. She's looking for some clarification. Can you, when it comes to camping, can you tent camp or just trailer or RV?
Whatever your preference, Amanda, come on down. You can do whatever you like. You are restricted to the developed campsites, so those sites are available for all that you just mentioned. You can trailer camp, RV camp, or tent camp, but you're welcome to do whatever your preference is.
Let's go to Dr. V for a moment. I know you've addressed this numerous times when you've come on, but people are still concerned about antibody testing. And so we had a question come in from Kara asking if antibody testing is available, if so, where, and how reliable are the results?
Okay, I think antibody testing is available at most labs. It's I've definitely heard the Quest has it. I imagine that most labs are carrying an antibody test at this time. But how good is it? I don't know. Many don't publish all of their tests, especially labs that make their own, so I don't know. But the problem with these tests that I've explained a couple times is that when there are very few, it's a rare positivity, There are very few expected positives, so we would only expect certainly less than 5% of our population at this point to have a positive antibody. So when that is so low, the test is just not a reliable test. And so if you look at even a really good test, it will come out to be about half of the positives will be a false positive, and half the positives will be a true positive. So on an individual level, you can go get the test done, and it doesn't really help you know very much, because if it's negative, okay. But if it's positive, you don't know if that's a true positive or a false positive. So it's very difficult to interpret. It works on a population level because we know that that's the fact. So if we test 1,000 people and we get a certain proportion positive, we can kind of figure out what the immunity is in the population. But at this point, I'd expect it to be low. I think these tests will have value getting some information now and then coming back in some months and seeing how quickly or slowly we're building up our immunity or back to our herd immunity. It will help us, I think, really plan our future activities.
Dr. V, we'll stick with you for just a moment. We have a couple of questions for you. This first one, because it kind of ties in with antibodies, another common question that we get pretty often is from Jeff. He's asking, are there any updates on a vaccine?
So yes, I have not heard, I mean, I think a lot of people have heard that they've had some trials and it looks kind of good so far. But I think it's still a ways away. I think most people will tell you it's still a ways away. It's nice that we're not getting bad news. I mean, that's great news. But we need to continue moving forward. Vaccines are tough to develop and tough to get all the way through to the approval process. So because we can't do human studies, appropriately so, what they usually do in vaccine studies, which I believe they're doing in these, are they're measuring, again, antibody development. We still don't know that antibody development, even though people are developing it, we don't know that that's going to confer immunity yet, right? Because we can't expose the people now and see if they get sick. And so it takes a while to do these studies and to figure out if this vaccine is actually protecting you, because that's really the question. Is it safe, and is it going to give protection? And so time will tell. We'll wait and see. At least it's not bad news so far. So it will still be a while until we know more.
Thank you for that, Dr. V. Mm-hmm. There are people in the community obviously concerned about the at-risk population and seniors falling in that category. Vicki asked, with businesses and services opening, how safe, if at all, is it for seniors in their 70s venturing out? She says she's been to Home Depot, Lowe's, Ace Hardware, garden sections, and she says that probably 75% of shoppers are not wearing a mask, but she does, and she finds it discouraging to see so many people not complying or caring about others. What would you say to Vicki?
Well, that I'm sorry. It's wearing a face covering is important to stop spread of disease. And really, when people are out and about, everybody should be wearing one when you're in these businesses and stores. We really promote this very strongly. It's done to protect the people around you. And when everyone wears it, you really are going to decrease spread in these businesses. I mean, we don't want to go backwards. We want to continue moving forwards and opening things. And it really is going to take all of us. So washing our hands, wearing our face covering when we're out in public, staying home if we're sick. And so the question at the very beginning was, how safe was it for someone who's 70 to go out? And, you know, every time you go out, there's a risk. You know, how small, how big, some of that depends on you, and you're washing your hands, you're keeping your social distance as best as you can, keeping your hands away from your eyes, nose, and mouth. The truly safe thing is to stay home. That's not always possible. But taking the precautions that you take sound very good. I'm so happy you're wearing your face covering. I am discouraged that more people don't, because I do think it's important.
Thanks, Dr. V. This next question is for Kristen. This is coming in from Jimmy. Jimmy wants to know, when is stage 3 scheduled to roll out in Stanislaus County?
So unfortunately, we can't answer that question because we're subject to the state order. And at this point, Governor Newsom isn't allowing local decision making on the various stages. He did grant us a county variance, but only for completing stage 2. So as it relates to additional activities in stage 3 beyond hair salons and barbershops, we're really waiting for additional information and guidance from Governor Newsom's office and the California Department of Public Health. We did hear this morning, it was actually out on Twitter this morning from the governor in a meeting that he had, that he may put guidance out for gyms as early as next week. I was surprised to see that because previously he had indicated we were maybe at least a couple of weeks out before anything else. But he did say that he is looking at putting out guidance for gyms next week and considering allowing them at some level under very specific guidelines. We don't know that to be a fact. I'm sure his office will continue to monitor the situation over the next few days, but that's probably what we could expect as the next step within stage 3. But I don't think he's going to allow counties to open all businesses that are listed within stage 3 at one time. I think he's going to space them out a little bit as he did with stage 2.
We'll stick with you for a moment, Kristen, while we're trying to answer questions that are hard to answer. Several people are asking about when things like bowling alleys, water parks, churches, and libraries can open. Can you speak to that?
I can, and again, we wish we had more specific information and concrete information to be able to provide to people. We would love nothing more than to have the decision-making authority for each of these and believe we could do that in a methodical way that respects what our local data and medical science is telling us. Having said that, we're not being allowed to do that. We're subject to the state order. So we would anticipate something like a bowling alley, for example, would probably be treated similar to a movie theater or another larger entertainment type of venue, and therefore will probably fall somewhere under stage 3. So there are so many activities that aren't specifically spoken to in the stages that the state has put out. Bowling alleys is one of them. Water parks is one of them. Some of the salon services we heard about earlier fall in that category where they're not spoken to specifically, but our hope is that as time moves on, similar businesses, that these will be captured within those. So again, all of those will be in stage 3, but will probably be spaced out over time, over the next few weeks.
Thank you, Kristen. We're going to go back to Dr. V. Brenda is asking, I think you hinted on this a little bit earlier, but Brenda wants to know, are masks required in Stanislaus County while running errands, or if you get your hair cut, and are cashiers, stylists, etc., required to wear masks?
So there is no specific order in this county requiring the wearing of a face covering. There is in the hair and barber shop guidance, I would encourage people to read that because most of your questions I think are really around that. And there is the requirement in there for both the stylist and the patron to wear face coverings or masks. I would have to look at it again about cashiers. I'm not sure. I think they should. I'm not sure that's in the guidance, but I would have to go back and read. And I encourage everyone in the business to be sure and read that.
So, Dr. V, we have increased testing tremendously in the last month, and we've seen a significant increase in both positives and negatives. We now have a team of employees working on contact tracing. A lot of questions have come in about what that is, and you have explained it, but can you once again just touch on what contact tracing is, what that process looks like, and how it helps manage the spread of the virus?
So when we get a report of a positive, we call them up and talk to them about all the people they've been in contact with for at least 10 minutes, face-to-face, from 2 days before they had their symptoms up until the time they knew that they were positive. So, I mean, basically who they've been around and who could possibly have been exposed. And then what we like to do is put those people, ask them to stay home. So that's quarantine. So the sick person goes in isolation, the exposed people go in quarantine. And the goal of this is to stop spread. So people who are exposed are, of course, the next people that are going to become ill and then spread the disease further. So the whole point of this is to stop the spread. And one of the goals we have is that most of our new cases arise from those in quarantine, because that way we know that we have stopped the spread. They've stayed home, they've protected all the people around them, and spread stops with them. And so we want spread to stop there so that they don't go on and spread it to their family, their loved ones, and their friends.
Dr. V, we'll stick with you for one more question. At this point, do you think that we're in the clear? Can we just go back to normal this summer? And why are people now talking about a second wave?
So the virus is still here. The virus is still spreading. I mean, you can look at our daily increase in numbers and you know that that's happening. So we can't go back to normal, what we want to call normal. We have to go to the new normal at this time. There's a lot of talk about a second wave. That's what we've seen with many previous pandemics. So as the air gets cooler, kids go back to school, hopefully, people start mixing more, we see an increase starting in the fall. I mean, that's when we see flu increases. Our usual seasonal respiratory viruses start to increase. And so we would expect to see an increase in the fall. We saw that in 2009. We saw that in the 1918 pandemic. We would expect to see that with increase in cases. So that's what people are calling the second wave, is an increase in the fall after decreasing during the summer due to the heat that we talked about a little bit. So it's not, we're not in the clear at all. We need to constantly remain vigilant and have this become our new normal. So we need to remember that social distancing is very important. We need to remember to wear face coverings when we go out into public. We need to remember to wash our hands frequently, often, and for at least 20 seconds. Stay home if we're sick. All those usual guidance that are really going to protect us and those around us.
Thank you so much, Dr. V. For our final question of the night, we're going to go to Supervisor Olson. Now that businesses throughout the county are reopening, how should business owners know that they're following guidelines properly?
I think this is a great question to end tonight's Facebook Live on, because it gives us hope that we're moving forward. I'm so proud of all the people across the county who came together to create a document called Good to Go. We've talked about the Good to Go document a lot on this program, but there are different components of it. So if people go to www.goodtogostanislaus.com, and 2 is the number 2, not spelled out, so goodtogostanislaus.com, they will find the document that provides guidelines for just about every sector. As we said earlier, we still have to add youth sports to it. That should be up there soon. But just about every sector in our economy, from restaurants to retail to hair salons to gyms, can go there and learn of safe guidelines for reopening their businesses. The second component of it is just as important, because we know that businesses will be successful in their openings only to the extent that consumers have confidence that they're safe when they enter those establishments. And so part of this Good to Go package is helping businesses show their customers that they are safe when they're in their establishments. And so there's a free training component that's part of Good to Go, and this was developed by our local business community. For businesses that take this training and have their employees take this training, they can get certified with a Good to Go certification and be provided with a marketing toolkit that provides stickers or window decals for their windows, social media badges, other ideas for how to reach out to consumers to say, we're a safe business. We are good to go for you to eat in, shop in, work out in, etc. We've already had 50 businesses across Stanislaus County certified for these Good to Go programs, where 80% or more of their employees have gone through the training. So again, we just want to thank all the people who worked so hard in putting this program together. And again, people can go to goodtogostanislaus.com for more information on the safe guidelines and also the marketing aspects of it and the trainings.
Fantastic. Thank you. It's a good note to end on. We want to thank all of our panelists for being here tonight and answering questions directly from our community.
And thank you at home for sending in your questions. If we didn't get to your question tonight, we'll continue to answer them online and in our daily updates Monday through Friday.
And as a reminder, you can find us on Facebook, YouTube, Twitter, and Instagram. Just search for the keywords Stan Emergency.
Thanks again, and we'll see you next Wednesday for another Facebook Live Q&A at 5:30. Stay safe, stay healthy, and stay informed, everyone. Good night.